Welcome to World Chef Podcast. I'm your host, Ragnar. You're listening to World on a Plate. And today, joining us on the podcast is a world-renowned doctor, a chef, a teacher, and author. I've got with me Dr. Timothy Harlan, otherwise known as Dr. Gourmet. So Dr. Harlan is a chef who turned doctor and revolutionizing healthcare by bridging the gap between food and health. And so today he is internationally recognized as a leader in the field of culinary medicine. We're going to talk about that. And so together we're gonna take a closer look at Dr. Harlan's, Timothy's journey from the kitchen to the clinic, as we could say, reshaping the conversation between the healthy eating and how you teach and to prevent and treat diseases using, well, the most powerful tool we have, which is food. So Timothy, Dr. Harlan, Timothy, chef, glad to have you here on the show. Thank you for joining us.
Great to be with you, Chef. Great to be with you, Chef.
Yeah, such an interesting topic, in fact. And I mean, you tell us your story. You went from you were managing your first restaurant at 18, I gather, and you had your own restaurant, Le Petit Café. I guess a Parisian bistro type of thing too. So from having that as a chef, what made you decide to like change careers and tell us more about that?
Well, it's an interesting question. I grew up around food. It was the 70s, 60s, and 70s. And, good food was becoming something that, everybody began to appreciate. James Beard and Julia Child, Graham Kerr, the Galloping Gourmet. I watched Graham Kerr in the late 60s. In black and white television, and just that whole idea about food was really appealing to me. I started working in restaurants very young, back in the day when you could do that, and started washing dishes. I think my mother was happy to know where I was on a Friday night. And by the time I was 18, I had managed my first restaurant. By the time I was 22, as you mentioned, I opened a small French bistro called Le Petit Café. And I ran that restaurant for a few years. I think I'm a pretty good chef. Probably wasn't the best business person, as happens in a lot of restaurants. Closed that restaurant with the intention of changing careers, potentially, not sure. Ended up going to college to get a hotel and restaurant management degree, thinking that was the missing link for me. And while I was there, one of my family members was having some pretty serious health problems, and I became very involved in their care. And one thing led to another, and I just became very, very interested in medicine. And it was also kind of the first time I'd just always been in the restaurant business, and it was. But now I'm about 25 or so. It was the first time where I was like, wow, there's this whole other world of things that I can do. And the challenge, though, for me, when I got to medical school a few years later at Emory, and this is the mid 80s, and this is kind of the bad old days of nutrition in medicine, where we were telling people don't eat eggs and don't eat butter, but we were telling them to eat margarine, exactly the opposite of what we should have been doing. But nobody was really talking about food with their patients. And I just became very interested in that. I had adapted all of my recipes and wrote my first book while I was in medical school, kind of a food manual for patients with cardiovascular disease. And the rest has grown from there.
Wow, that's amazing. And I mean, so do you think like you have unique insights as being both a chef and a physician? You have a different approach to. Are you firstly a chef or a physician? Is it how?
I think it's a great,
what is a special combination? Yeah.
So I would say, from my standpoint, that and there's a lot. It used to be I was kind of unique, a chef and physician. There's a lot of physicians out there who have gone to culinary school either before or after going to medical school. So this is not all that unique anymore. Okay. But I think what it allows is that I come to the conversation from a food first perspective, not from a clinical perspective, but from, look, this has to be great food that just happens to be great for you. And that's really interesting when you think about what it means to be a chef. and the training that chefs get, because you're using great quality, fresh, and these days more and more local, when possible, ingredients in a way that just happens to be healthy. So I think the unique piece, if you will, for those of us who do what I do for a living is that we come to it from that food first perspective.
Yeah, I mean, yeah, you talk about eating well and eating healthy. These are two the same thing. So
Yep.
and I saw that in your book. So I don't know. Can you elaborate on that? How can our industry should be debunking towards is eating healthy versus indulging? Is there a competition there?
Well, look, I think
Healthy
the
versus
key
indulging.
is on a day-to-day basis, eating healthy, having a really great quality breakfast, having a really great quality lunch, most of the time, eating fabulous food for dinner. And indulgences are important. They're an important part of life. They're an important part of enjoyment. And I think the challenge can always be that food has a lot of different roles in our life. Obviously, it's fuel. It sustains us. It's comforting. It's social. It's cultural. So there's all of these pieces that go into it. But I think what we have tried to do in the culinary medicine movement is create an environment where that baseline cooking, that baseline consumption is real food. So that's really where chefs come into play. There's a big difference between fast food and highly processed, ultra processed food that is taken out of boxes and assembled in restaurants and given to patrons. There's a very distinct difference between that and a chef who makes recipes, meals, dinners, entrees, appetizers, salads, dressings, soups from real ingredients and serves those to their patrons. And that's really the foundation, I think, of culinary medicine, is just getting back to eating real food. The programming that I helped develop, the Health Meets Food courseware that's used by medical schools and culinary schools across the country to teach their students, uses Mediterranean diet principles as its foundation. And that probably means different things to folks. When I say Mediterranean diet, you think maybe olive oil and red wine and maybe hummus, but it's not really about recipes. It's about the palette, if you will, of what you cook with. More vegetables, more legumes. We love legumes. More fruits and nuts, more whole grains, more seafood, but less seafood than you think. Better quality oils and fats, less dairy, but still great quality fermented dairy. And in this day and age, I think we now know that probably whole milk dairy, less land animal protein, and alcohol in moderation. That 9-point Mediterranean diet score is what really can help drive chefs to use those ingredients thoughtfully and wisely to just create better food that's better for you, that just happens to be better for you. And interestingly, cheaper, saving food costs, and that's the real important piece is, look, chefs have to make a living, you have to be able to control your food costs. And it's a lot easier, and has been shown over and over and over and over again, that it's cheaper to eat healthy than it is to not eat healthy. So I don't see that the two are mutually exclusive. Eating great healthy food and indulgences, I don't see those are mutually exclusive at all.
No, precisely. And I mean, somebody said, and I don't know if it's true, that there is a reason why the chefs wear a white jacket just as a physician do, like a doctor would. And actually, it used to be the same profession, is that you heal people through what you put into them, whether it's today, probably, unfortunately, a lot of pills instead of actually just taking care of what you, in fact, eat as a daily diet.
Yeah, my colleague, who I think you may know, Chef Carl Guggenmoss, who was the
Right,
Dean
yes.
Emeritus of Johnson Wales. Carl has been talking about this since we met now, I guess almost 15 years ago. The idea that we're marrying, if you will, those two white coats. And we wear those white coats for a couple of different reasons. One, it looks clean, it looks sanitary, it protects our clothing, but at the same time, it also shows that we're doing something that's healthy, that's healing, like you said. I actually have we have a photo somewhere. I wish I had known we were going to have this discussion of a medical student who's at graduation, whose mortarboard, they had decorated their mortarboard, and it's the back. It's a shot of the back of their head, and it says, "I wear two white coats."
Exactly, exactly. I always have this memory of when I was traveling in China, and we were invited at this big round table, as they do in China. So big round table with a lot of dishes that came over, and one of actually our translator was not feeling. So she had been with us for 2 3 days and caught a bit of a cold while they're walking around, and so she told the waiters like, I'm not feeling good, and I'm throat is I'm catching a cold or something, and uh, and so I just noticed because she was sitting next to me, and she was getting completely different food than I was, and so the chef reacted actually to what she said, and made a completely different menu of, I think, about like probably 7 courses. There was sort of to be her healing.
Yeah,
It's
it's a great
really,
example. It's a great example of the power of food. I think we all think of that sort of classic chicken noodle soup when you're sick, or those things that, and whether they're actually making us better is hard to know for sure. There is a little bit of research that says chicken noodle soup may actually help with how white blood cells are managed in the body, if you will. But who cares? It's just comforting. It just feels good. And so I think there's that piece that we know that eating great quality food can make you healthier if you're unhealthy, or keep you healthier. But it also, again, just that comfort factor around food and those things that we hold, that are cultural for us, that are great memories. I mean, that can be something as simple as a tuna noodle casserole, which is, decidedly an American concoction. But, it's delicious, it's warm, it's comforting. And with just a few thoughtful ways of making that recipe, whole wheat pasta, for example, the tuna is really healthy. The peas, those are legumes. It's really easy, again, to make great food that's comforting, that is also healing.
exactly, exactly. And so you have no, it's a really interesting topic, and you pioneered what you call the health meets food culinary medicine curriculum. So it's a study
Yep.
program you created. So you've been teaching that and operating that in a medical school where students they take, there are culinary students and medical students working side by side in the kitchen. Is that so? So can you tell us about
In
this?
a lot of cases, it depends on the medical school.
Right.
So the programming we started developing at Tulane, and started sharing that courseware with other medical schools across the country back in about 2014, and now over 60 academic medical centers across the country use the Health Meets Food culinary medicine programming. There is programming that is specifically directed at for healthcare professionals in training, and as well as community courseware. So one of the things that the teaching kitchens that are being run across the country, that the model is, we teach the medical students and they become the force multiplier to help teach the community. In some sites, in some of our partner sites, they do collaborate very closely with culinary schools, and that's been the vision since about 2014. And in 2022, nonprofit that manages the courseware is called the American College of Culinary Medicine, launched parallel programming for culinary schools. And there's, I think, about 5 culinary schools right now. The first was Frederick Community College in Maryland, and Chef Elizabeth DeRose and her team have done an amazing job at training future chefs as part of their courseware to how to think about what they're going to be feeding their patrons. And so we do see this sort of Venn diagram, if you will, where you have one circle is healthcare professionals, physicians, nurses, dietitians, nurse practitioners, et cetera, pharmacists. You have chefs and food service professionals and the community all, learning from that same courseware, that same evidence-based curriculum that helps people just eat great food that happens to be great for them. And so, again, I actually have a meeting this afternoon with another culinary school to discuss them launching the Health Meets Food programming. So we see this as being a significant way for us to change how we all think about food in a really positive way. Again, great food that just happens to be great for you. And in the case of our chef colleagues, that costs you less and maybe improves your profit margin at the same time. So it's been really exciting. There is equally also a certification program for healthcare professionals. That's been around since about 2015, but there's also now a certification program in culinary medicine for chefs and food service professionals. And people can find that information at culinarymedicine.org. The American College of Culinary Medicine also has a yearly conference that brings together chefs, food service professionals, community members, healthcare professionals to talk together and learn together and stand shoulder to shoulder in the kitchen. It's been a very cool project.
Cool, yeah, and actually that was my other question actually, and you just mentioned, and maybe I should highlight that. So like if there are any practical tips or resources that chef can go to now. You just mentioned a website, and please repeat, and then I could put this on our podcast page, and we can share that with our audience.
So culinarymedicine.org. Culinarymedicine.org is the home, if you will, the website home of the American College of Culinary Medicine. There are tons of resources there already about how to get involved. If one of your listeners is at a culinary school and they want to launch Health Meets Food programming or certification programs at their culinary school, there's a form there for them to reach out. But there's also recipes, information, and that website is growing into very much an active resource for healthcare professionals, community members, and food service professionals.
Mm-hmm. Hey, and so yeah, really good. So thank you for that, sharing that, and we're gonna share that with our community for those who want to know more. And I hope our audience is attentive to that and they want to know more. But you've been working so as a chef and then into medicine, and you've been working with with culinary students, with chefs to explain your approach. Are there like any very common misconceptions or typical challenges you encounter talking to chefs when you're trying to have them like focus on or prioritize health and nutrition? Not necessarily. Is there like, do they have a misconception of, no, I'm here to indulge them and let's put more cream? Well, cream can be good. I don't know. You tell me.
So that's a really interesting thought, Chef. I would say no. And part of that is, what in research is called selection bias. Most of the people that I do interact with are interested in the topic and they want to think about how they can make changes. So I would say that's really not as much an issue. Now, 10, 12, 15 years ago, it might have been a different conversation, but I think that chefs today do feel a responsibility Chef Carl has said, again, for a decade, he believes that chefs have a moral responsibility to serve the best quality, healthiest food to their patrons. So I think that mindset is already grown to a significant point within the culinary world. So I don't think that there's a lot of barriers there. I think the challenge is, as with medical students, as with healthcare professionals, we didn't get the education when we were in medical school. And I was in medical school up until about 10 years ago. Food just wasn't part of the curriculum. Mm-hmm. And in the same way that there's some, sort of lip service paid to it. And we're going to talk about nutrition, but nutrition could mean a lot of different things. Metabolism, digestion, vitamins, etc. On the culinary school side, I think the culinary schools are at the point where a lot of medical schools were about 10 years ago, where they're recognizing that they need to educate their future chefs in a different way about the nutrition piece. So most culinary schools have always had a dietitian and had a nutrition course, but that nutrition course, again, has always been a much more clinically focused nutrition, like the clinically focused nutrition education physicians get. And what we're trying to change in that equation is that this has to come from a food first perspective. You have to start with the ingredients. You have to know what those ingredients, why they're important. Why do you need to get more whole grains? Why do you need to have more legumes? What is it about these? Why do you need to reduce the amount of sugar? Why do you need to change the amount of salt? How can you do that? So I think right now I don't get a lot of barriers or resistance in the conversations that we're having. What I think we get is, as on the healthcare side, we have a knowledge deficit. That's changing now in both fields at a breakneck pace. And I think what the American College of Culinary Medicine is working to do is to bring those worlds together, where we are having that handshake conversation all the time. One of the best examples of this is Northwell Health. This is a large hospital system in the New York area, New York, Connecticut, up east. I think they have 18 hospitals. And a few years back, they hired Chef Bruno Tisson, a Michelin-starred chef, to run their food service programming. And he, go just your listeners should go and just Google Bruno Tisson. There's some videos that are amazing where he talks about how when he showed up in the kitchens, they had nothing but frozen food in boxes that were out of date, that were just, it was absurd. And kind of the barriers that he met in trying to bring real food to the hospital setting.
Exactly, yeah.
And so, look, that's the kind of change that's occurring on the food service realm. So I think, as they say, that train has left the station. I think we're all on board, and I think we're all on board.
That's really interesting you mentioned it, because this is what I was thinking, actually. There is this, it's almost like a joke, a practical joke, that like, oh, if you're committed to a hospital, if your disease doesn't kill you, the food there will kill you. and so it's hospital food is sort of known to be so bad. Fortunately, yep. I haven't spent time in hospitals. Maybe you have seen change in hospitals. Actually, I would think. Yes. I think that if you have patients and you have to run a hospital, you want to make sure that they get well quickly. Then actually part of the healing process is not just the tablets from the pharmaceutical companies, it's actually what you feed them 3 times a day.
Yeah. And I think that, for hospital administrators in the past, and in their defense, they weren't educated on this either, but hospital administrators in the past, food was just that afterthought. It's okay, we have to feed people, and here's how much money we have, do what you need to do. And again, in their defense, the food service professionals did what they were asked to do. it's not just the food that you get or the quality of the food that you have traditionally gotten. Again, changing across the country, across the United States at least, at breakneck pace. But it's not just the sort of quality of the food, but how it's delivered, et cetera. On the other side of that coin is, we physicians tend to not know a lot about that either. And we've sort of abdicated that responsibility. And I think that's one of the things that the culinary medicine movement is working to do on the healthcare professional side is really work and interact with hospital systems, with their own hospital food service to make those changes. We also have a tendency to starve people a lot. Like we put you in the hospital, maybe you've got a GI problem or you're having surgery, and so we don't feed you, and then we don't feed you for another 12 hours after you've had surgery, and by the time you're ready to eat, now they're bringing you this horrible food. It's just there's so many issues along that workflow, along that timeline that need resolution. That is, again, I think is happening really, really fast, at least here in America, really quickly. And again, I think it's people like Chef Bruno Thyssen who are responsible for that, Carl Guggenmoss, the Elizabeth DeRose at Frederick Community College, these chefs who are standing up and saying, this is an important piece of what we need to be doing.
Yeah, yeah. And I mean, and even apart from just thinking what you're saying, even apart from the nutritional value, as we know, food also gives us a lot of pleasures. It hits the pleasure zone in our brain. And I can imagine that, when you heal, yeah, pharmaceutics are great. They do fantastic work. We can heal diseases, but a lot of it is also psychological and bringing happiness, happy thoughts that actually you can transmit through food actually is beyond the actual nutritional value, is a psychological value.
Yeah, you're spot on. And the really interesting thing is, and again, I'm an internist. I believe in the pharmaceutical piece, and I don't want to prescribe cholesterol lowering medications, statins, or blood pressure medication, but thank goodness we have that. I mean, the power of what we're able to do today versus even 30 years ago is amazing. But it's really interesting. There's research that shows when you put together the statin, cholesterol lowering medication, with a healthy diet, when you put those two together, they are synergistic. 1 + 1 = about 2.6. So you get more bang for your buck out of the medication by eating healthy. And again, I think the big misconception is that eating healthy is boring. But I don't know what's boring about chana masala. Like, I have no idea what's boring about chana masala. One of the main points of the Mediterranean diet score is whole grains. So corn is a whole grain. Most people kind of think of corn as a vegetable, and it is vegetable matter, but it's actually a whole grain, which means that cornmeal, ground cornmeal, is a whole grain, which means corn tortillas are a whole grain, which means tacos are Mediterranean diet. So that's what the courseware does. It just shows how to make that translation to using corn tortillas instead of flour tortillas. You're still making fabulous tacos, fish tacos, shrimp tacos, mushroom. I mean, you still make amazing food, but instead of using the flour tortillas, which are basically just sugar dipped in salt in a way. That's kind of how your body sees it. They're really nutritionally vacant.
Yeah, yeah.
To using great quality ingredients. And a taco is a taco is a taco. A good taco is a good taco. Yeah. And again, that's Mediterranean diet.
Absolutely. And I think that's very important, is actually, it's the ingredient. It's not the word taco. It's not the word. I often take mayonnaise as an example. I enjoy to make some hamburgers at home, and for my kids, they love it, and I put some mayonnaise on that. But if you think of mayonnaise, it's only 3 ingredients. It takes you 5 minutes to make it. If you take the bottle in your fridge, you get to find in a supermarket, it's 15 ingredients, and it actually lasts 5 years. something is not right.
Something's wrong. Something's wrong.
Something's
You're
wrong.
exactly correct.
So,
So you're exactly correct. And interestingly, using egg, great quality olive oil, little tiny bit of vinegar, maybe a little dry mustard, ground mustard. I mean, you can make amazing mayonnaise. And for the lay public, for community, for the folks who are your patrons and my patients, it's easy for them to make too using an immersion blender. I mean, it is so easy to make mayonnaise, and it's so freaking delicious.
yeah,
It's really good. And you're using olive oil. Doesn't have to be extra virgin. That might be a little different flavor than a lot of folks. Just a nice virgin olive oil, great quality oil. Whereas the mayonnaise that's on the shelf with all the stabilizers and emulsifiers and those 15 ingredients, and it's probably more like 20 or 25, is also using an oil that's not really the best quality. So that's the key. Quality ingredients make great food that just happens to be great for you.
exactly. Somebody said like you can eat whatever you like as long as you can make it yourself or cook it yourself or assemble it yourself. Is when we have the processing food industry that is adding, as you said, the emulsifiers and all that. Common mistakes is that we think of that as now as fast food or unhealthy food, but actually the actual real ingredient is so natural and it's just tasty and great. So,
Well, I think of a lot of those ingredients, and look, mayonnaise is not something everybody's going to make, right? But using the mayonnaise in a that you're buying off the shelf, in a thoughtful way, so you're minimizing the potential harm, and you're pairing it with other great quality ingredients. So it's not an all or none. In an ideal world, yeah, make your own mayonnaise, which I do pretty frequently. But I also have a jar of mayonnaise in my refrigerator that I use for making, when I want to make a quick green goddess dressing or something like that. But it's about that sort of balance of getting it right the majority of the time. And so again, I think it's always a challenge, and there's always going to be that little bit of tug of war. But that's a very big difference between, again, putting a little bit of store-bought mayonnaise on your burger and going to a burger place where the food really isn't food, but it's a technical construct that resembles food.
no, you're right. It's really that balance and you can't be dogmatic about everything in life. You take side steps, but yeah, it's the general path, absolutely, and some easy choices. So hey, so thank you. Really, it's been a really great talk, and it's fascinating. Actually, it's fascinating and probably not talked about enough in culinary schools. But as we have sort of come to the conclusion that as long as you're making things from scratch and using top ingredients, fresh ingredients, local ingredients, then actually anything you eat is healthy in a sense. Anything that you can,
Yep.
in a certain balance and yeah, with that conception in mind that you're creating things from scratch in a sense. So if so, just to finish our talk. So for our listeners, if people are interested in getting involved in culinary medicine, let's say any chef out there wants to know more, is that possible? How can they dig deeper?
Absolutely. Again, go to culinarymedicine.org.
There.
And there's contact information there. I mean, I will say I'm pretty easy to find on the internet. If my email address is not really all that hidden. Send me an email directly if you prefer to do that. And happy to get on a Zoom and chat with people about what their interests are. And I think we've got a large enough network within the American College of Culinary Medicine where if you live in Denver, I can, introduce you to folks in your area. If you're, in Maryland and you're interested in going to culinary school or going back and getting certified, there are possibilities. There's possibilities for online programming. So absolutely, culinarymedicine.org is probably the quickest pathway to reach the right people. And some of that is maybe me, but also Chef Barbara Camp, who runs the food service programming for the college. She was on faculty for about 15 years at Johnson & Wales in Miami. She's a chef and a dietitian, has led the creation of the Health Meets Food programming for chefs and food service professionals. She's really anxious and eager to meet and talk with you as well.
Excellent. So hey, thank you very much for that, and thank you for your time.
It's great being with you, Chef. I really appreciate it.
Dr. Harlan, Chef Timothy, we can either or, as you wish. It's been great talking to you. Thank you for taking the time and sharing all this amazing content on our podcast. Thank you, Chef.
Thanks. Eat well.
Yes, and eat well. Thank you, everybody, for listening. I hope you enjoyed the show. You're listening to World Chef's podcast. I'm your host, Ragnar. This is World on a Plate. And yes, I wish you a very healthy and happy eating today, all of you. Again, take care and stay safe. Bye-bye.